So we'll do that. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And let's get to our, there we go. Kiwanis is a global organization of volunteers dedicated to improving the world, one child and one community at a time through service to others. Thank you. And Larry, you have the invocation today?
I do. Let us pause. May those assembled here today enjoy the many offerings of Kiwanis. We stand before you with hands, minds, and hearts you gave us. Help our hands to work at your service through our club, our minds and hearts to help those less fortunate. We pray for unity and healing for our country and for family and friends touched by the virus. Amen.
Amen. Thank you, Larry. Well, look, we've got Bud Arnold here today, and it actually seems to be working. Good job, Bud, but you're muted.
And I don't see him.
I see him.
I see
him. Yeah. So, hi, Bud.
He's frozen again.
I think he's frozen.
It's frozen again. Well, I thought it was working. I shouldn't have spoke up. Okay. And no guests today, except our speaker, who we'll introduce here in just a little bit. Mac, you raised your hand on the participants. Did you have something?
No, I just raised your hand, so I did.
Okay. Okay, I lowered your hand, so we're done. Announcements. And we're going to hear a lot more about this, I think, from Spencer. But the COVID vaccine is open to those 16 and over, effective March 31st. So get your kids and grandkids in there to get the vaccine, so we can get that moving better for everybody else. Volunteer opportunities. Friday, April 16th, we get to unload the Food Finders truck at the Youth Service Bureau. So that's an opportunity for us. And April 19th, we're packing backpacks for Nourish. Anybody want in on any of that? And I can sign you up. Hello? I guess.
I'll help pack backpacks on Monday.
Okay. Thank you, Carolyn.
I'll be out of town.
Okay. Anybody else? Jim, did you say something?
I'm signed up for helping unload the food truck.
Okay.
I am too.
Okay, thanks, Mac. Okay, we'll get that working, and probably it'd be nice to get the whole fire department out there, Spencer, and they can help unload the truck.
And say something to Chief Busenbark about that if you'd like.
There you go. That'd be great. We do. Hi, Don. How are you?
I'm doing well, thank you.
Glad to see you. Jerry, you still need speaker people for July? Is that right? You're muted, Jerry. Jerry, you're muted. Jerry, you're muted.
I touched the space bar and it didn't unmute. Sorry.
There you go.
There's five Thursdays in July, and so we're going to do it as a committee effort. If you have any ideas for someone who could do a program, I'm hopeful that we'll be back face to face by July. And if it's somebody that can only participate via Zoom, we can make arrangements to show that. But if you got any ideas, drop me a line or give me a call or a text. and let me know. But we've got 5 opportunities in July.
Good, thank you. So yeah, we'll get our speakers lined up for the rest of the year. Then that's all that Jerry has left is just July, so that'll be great. We had a great time this last week with our pancake week. It was just fantastic. We don't have final numbers on it, but it looks like it's going to be our best pancake event that we've had. So we're really excited about all of that. We've got a group that's going to look at the whole thing when we're done and try to see how we move forward with this. Did this work well? What else do we need to do? But we had a lot of fun with it. Got a lot of people out there and sold a lot of tickets. McDonald's sold a lot of pancakes. And so we raised a lot of money. Like I said, it's probably the best event we've had regarding Pancake Day or week or whatever you want to call it. So let's keep that. We'll keep that up. Once we get all the numbers, we'll get it out to everybody. But very, very glad to see it.
Hey, Gary.
Yes.
I was really surprised the day that I was at McDonald's South for that hour, 8:30 to 10:30, 2 hours.
Right.
The number of people who didn't know about Kiwanis Pancake Day, regular Kiwanis Pancake Day. I know we serve a lot of people, but you would think surely there would be someone that would know what that's all about. And there, in my 2 hours, there was no one, because we would ask them and tell them what the tickets are for and what we were doing. And, oh, okay, they had no idea.
Yeah, it is amazing. There were some people who were talking last night that we actually had people come through and donated money, and then they said, "Oh yeah, what's this for?" So same thing what you're saying, Mac, and we hear that, and I think that's where we need to do a better job as a club and as a group of people in getting the word out of what Kiwanis actually does. We need to be inviting more people to our meetings, letting people know what Kiwanis does. We've got some numbers. We'll talk about that just a little bit, but of what we've done in the past year, and gonna have I've asked Tori to put that into kind of a press release to see if we can do something with that. Hello, Diane. How are you? Glad to see you.
Hi.
Welcome back.
Thank you. Thank you.
Yeah.
Gary, I think one of the things that may have contributed to that is that, you know, in the past we've had all these yard signs scattered all over the town and the county, and we haven't had those out now for 2 years. If we do this again, whether we do it at the 4-H fairgrounds or whether we do it in conjunction with McDonald's, I think we need to find some way to do the yard sign campaign as well, because that makes it very, very visible to everybody.
Right. Right. And we're going to have a group of people that were involved with this, kind of have a sit down and look at what went right, what went wrong, what do we need to do next year, and what should we do? Should we do a 4-H thing, or should we do another McDonald's thing? When you look at it, the difference in manpower was quite different, and so it's very, very important that we look at the whole thing to see what we can do. It was very successful, like I said, and we need the money for fundraising. We need to continue the fundraising so we can continue the gifts that we provide to the children of Montgomery County. So we need to keep that going. The other help. Go ahead, Mac. I'm sorry.
Well, I was just going to say that it's like anything else. The first time you do it, it's more difficult, and you figure out the bugs that need to be taken care of. and it gets better. If we only do it one time, we'll never know how much better it could be.
You're right.
Using McDonald's.
Yeah, you're exactly right, Mac. And I don't know what percentage of the people that you talk to said, "Oh, I'm sorry, all I have is credit card or a debit card." We talked about that last night, and we're going to investigate getting that system to use the card readers out there too. And it would be, it would help even more to get that, to get those donations.
Well, I also think that not being able to go inside to eat would probably make a difference also.
Right. Yeah. Right. Yeah, if they could go inside to eat and have their pancakes, it'd probably be a much better, you would probably sell more tickets. Of course, we relied a lot on the donations, and we got a ton of donations. So it was great to see that. So like I said, we'll get the numbers out as soon as we get that all put together. The vaccine clinic over at the old Save a Lot. Yeah, they need help. They need some more volunteers. They've opened up on Fridays for the whole day. So they need more volunteers. They are using some National Guard people there, I guess. But they can use more volunteers. So if you can help, I know a few of us on here are signed up to work there. Mark, I think, is there every Saturday or something, and Terry and I have been trying to do a few Saturdays. But if you can help at all, please just notify Samantha Cravens at the health department, and she'll get you signed up for that. So and it's easy. There's there's things that anybody can do. I mean, if I can do something, that it's easy. So,
Gary, currently we're running Monday and Wednesday. They added Friday. Today, Thursday, is a special Hispanic vaccination day, right, and running Saturday all day as well. So yes, it's a great volunteer opportunity.
Right. Thanks, Mark. That, I see Mark there all the time, and I know other Kiwanians have been there. So please, if you can, I mean, it takes 3 or 4 hours out of your week if you can volunteer one shift. So and it's a lot of fun. A great way to meet people. As a matter of fact, I've got somebody I met there that wants to be involved with some of our Kiwanis stuff. So hopefully it'll lead to a new member. So if we could do that, that's the way to get involved. So
Gary, just out of curiosity, does any of the hours that we volunteer in a situation like that count as service hours for the club?
No,
they don't, unless we unless we were able to put that as an event that's supported by us completely. So they don't count. No.
That's what I thought. I just wanted to verify.
Yeah. So if you can, just let them know. Samantha Cravens at the health department. Member updates. I know Dave Polly, you talked to Dave Polly, Jerry. He couldn't make our meeting last night, but how's he doing now?
Yeah, I spoke to him this morning, and he feels like he's making progress, but he's 4 weeks out from his surgery at this point. The doctor said that it's going to be at least another 8 weeks before he's back to some semblance of normal, whatever normal is. He said he was going to go lay down after we got done talking. So he's still struggling, but he's making progress. He said he wishes he could have been at the board meeting last night, but just doesn't have the energy to do it right now. He said he never thought that a simple fall on the ice could do as much damage as he incurred. And between a punctured lung and 11 or 12 broken ribs and a lacerated diaphragm, he got beat up pretty bad. So keep him in your thoughts and prayers if you would, but he is making progress.
And I think he and his son are going to be selling those adapters for your shoes with the hooks on them, you know, for
the crampons, the strap-on crampons.
Yeah, you know, so, you know, and he's a living example of that. So we're all going to need those things on our shoes. Any other member updates? Anybody talk to anybody? Okay. Community involvement. And again, it's a great way to get people involved. You know, you talk to some of your friends, give them the link for the meetings. Let's get people to come to the meetings, and we're on Zoom. We talked about it last night at our board meeting. Our board meeting, by the way, was in person. But we talked about it last night. We think we'll probably continue putting these meetings on YouTube even when we are meeting in person. We're going to film them or not film them, but record them and put them on YouTube and make them available to everybody. So it would be really great. Invite some people to a meeting, and then let's get them involved. Let's get them helping us out on some of our efforts, and let's make them a member. So continue to try to do that. Anybody that still has, I guess we got 47 people that have turned in their ticket money. If there's anybody that has not turned in their ticket money for Pancake Day or Pancake Week, please get that to Sharon as soon as possible. We need to get that done. Service activities, annual report. And I found this, and I thought this was pretty interesting, and it's nice to know it's not as much as what we did in prior years, but the fact is this past year was just an amazing, interesting year. But we participated in 29 different projects, 705 service hours from the members of the club. So that's fantastic. That's in a year of COVID. That's amazing. We had 246 members involved. Now that counts, you know, one member multiple times working at various places. So 246 members, 29 non-members involved. And the most important one about this is we had 1,128 youth that were served through what we've done. So we can keep that up, and it's fantastic what we've done. And we just got to keep it going. Kiwanian birthdays this week. We've got John Cully on the 14th and Phil Boots on the 14th. So happy birthday, all. Glad to see you.
Happy birthday, John.
Yeah.
Happy birthday, John.
And didn't have any other birthdays that were important there. So we did those. Happy bucks. Riley Hospital was Q2, and the total amount we collected for Riley was $364.50 through Happy Bucks. So that's fantastic. We budgeted, or we expected, at least $250 a quarter, and we got $364.50. So keep that up with Happy Bucks. Let's do that. Thank you very, very much. This quarter is Mountie Mission, and I'll throw in $5 for Mountie Mission and their efforts. So anybody else happy?
Yeah, I'll put in $5, Gary, for the mission, and like you said, for the fact that I don't have to mow this afternoon.
Yeah, that's right. Anybody else?
I'll throw in $5 for Mountie.
Thank you. Thank you.
I've got $5 for the Mountie Mission too, and I'm so happy that my lawnmower started on the very first try.
You had much better luck than I did, Larry.
Nothing runs like a deer.
There you go. There you go. Well, thank you all very much, and just get that money into Sharon, we'll get that all recorded to keep that up. On this day, April 8th today, and this is for Spencer. 1766, the first fire escape was patented. So, and it was a wicker basket on a pulley and chain. So a little bit different than what we have today. 1796, Carl Friedrich Gauss, a German mathematician, proves the quadratic reciprocity law. Well, who can explain that to me? I had no idea, but he did. And in 1956, this is for Mac, the 20th U.S. Masters Tournament. Jack Burke Jr. won his first major title, one stroke ahead of amateur Ken Venturi. It was the final Masters played without a 36-hole cut. So interesting. 1956. So they're starting the Masters today down in Augusta. So it'll be some good watching to see what all happens at that thing. Our speaker today is Spencer Stevens. We had his boss set up to do this, but Spencer told his boss, no, you don't want to do it, I'll do it. So thanks, Spencer. Spencer is with the Crawfordsville Fire Department. He's in the EMS Homebound Hoosier program. Was hired in 2020 to lead the Vaccination and Immunization Division of Crawfordsville Fire Department's Community Paramedic Division. He came to this role with 15 years of EMS healthcare experience, licensed paramedic, father of 2 daughters, 8 and 10, passionate about medicine and serving the community I came from. So, Spencer, we're glad to have you here. I'm going to mute everybody. So, Spencer, you're going to have to take yourself off mute. And so we can make sure we can hear you, but everybody else will be quiet for us. So, Spencer, thank you very much. Go ahead. You're on mute.
Yeah.
There you go.
Give me just a second here. I'm going to try and share this PowerPoint. Apparently, I did not give. Just a second. I got to give it permission to share my desktop here real quick.
Okay.
No, I'll get the PowerPoint up that I have for you guys.
Let's see here. Did you get the invite thing?
Yeah, I just have to go in and change
okay.
the permission real quick on my end.
Okay.
I didn't have it set to where it would share my desktop. So give me just a second here. Sorry to
no problem.
Burn time.
Yeah, I had talked to Paul Miller a month or so ago, and he said they've got a new interesting program, and he wanted to present on that, and then he assigned it to Spencer. So so we set it up so that either Paul or Spencer could come and visit with us, and that's why we're here today.
All right. I've asked it to let me share my screen. Share screen, PowerPoint.
There we go.
All right. All right, you guys see that all right?
Yes.
Fantastic. So this is just going to be a brief overview of the vaccination immunization program that we are doing. We started in 2020 with getting state verification to do vaccinations and immunizations. We are currently the only fire department in the United States that we're aware of doing vaccinations and immunizations. So that is something we're leading the field on. And then Crawfordsville as a whole has one of the most robust community paramedicine programs in the US as well. This program is looked to by a lot of areas as leading the way in community paramedicine. So this PowerPoint will take about 15 minutes. We'll run through all the different areas of the program itself, and then I'll let you guys get about your day. So we'll get started here. Oh, I got to make it change. There we go. So Paul Miller, he is the chief of EMS. He's the program director over the community paramedicine program. This is the photo we use for all of his ads because he, looks the coolest in it. So we try and use this one for all of them. But he is the program director. I'm the vaccine administrator. I take care of making sure that our vaccine stock is taken care of, making sure that all of our paperwork's up to date, scheduling events, coordinating events with the schools and the community, and then coordinating with the health department for collaborative efforts with them as well. Our medical direction, Dr. Scott Douglas. He is a medical director over the Vaccination Immunization Division. We also have Dr. John Roberts. He is over our 911 side and part of community paramedicine. And Dr. Krumenacker. He is also over part of community paramedicine. So we have a handful of medical oversight here for us. Program mission statement, no child or adult left unvaccinated through reducing barriers and increasing accessibility to vaccinations and immunizations via the mobile integrated healthcare platform or program model. So that allows us to use what we are good at, which is being in the home, in various locations, being mobile, and using that to increase accessibility to vaccinations for children and adults. So whether that be going out to the schools to do clinics, whether that be doing mobile clinics, things of that nature, that's really our wheelhouse is being outside of the comfort of that office type area, like what the health department would function in, or like a doctor's office would function in. So we got started with identifying the need. In 2020, they identified a need for this program, and then the state funded it through a grant. And the real purpose of this was to identify how to build the program itself. So they were looking to find out how they could replicate this in other areas that it might be of value. So if you had a large metropolitan area that had a very largely underserved child population that had low vaccination or immunization rates, they would take this model and be able to replicate it other places. So the grant was given to Crawfordsville Fire Department. I was hired in October, and we started, hit the ground running then to work on getting our state certification and be able to get vaccine stock on hand and all of the other challenges that we faced very quickly after getting started on this venture. In January of 2021, we became the first fire department in the United States to be giving vaccinations and immunizations as part of our community paramedicine program. And then also at the same time, we became the first fire department in the state of Indiana to be doing the same thing, only we are also vaccines for children certified as well, and then giving the 317 or 317 program vaccines to adults without insurance as well. We have access to private vaccine through the VaxCare program. It's a vendor that provides us with vaccine, kind of like an on-consignment deal. We hold the vaccine here, we administer it, and they take care of the billing on that end for the private insurance customers. This places us in a position to where we have vaccine to administer from cradle to grave for all walks, insured, uninsured, underinsured. We're able to provide that vaccine to individuals without having to turn anyone away. Infrastructure getting started was obtaining pharmacy refrigeration and freezer units. That was a challenge. Temperature monitoring units, we needed to obtain those. Equipment for safe transport of vaccine. And then we've actually set up a mobile clinic to be able to go out and do mobile vaccination clinics. We've had a lot of collaboration with the Montgomery County Health Department, with Amber Reed and Samantha Cravens. They've been fantastic. We've worked with them through, obviously we chose an excellent time to start a vaccination immunization program in the middle of a pandemic. So it's really come in handy that we are getting up to speed on a lot of these things and building up this infrastructure. Had this have not been in place or us be in the process of doing this, there would have been a handful of things that we just wouldn't have been able to do. We've been able to really lean on our wheelhouse of going out into the community, being being able to go mobile and set up in different places, as well as just overall being flexible. And one of the things we mentioned earlier was the homebound program, for instance. That was something that nobody else was doing before we started it. You guys have probably seen it on the news a handful of times, and we'll talk about that a little later. but no one was doing that before we started doing that. So we've been leaning on the health department's strengths, and they've been leaning on our strengths, and it's been a really good collaboration so far. CDC training and guidance. As we got started, there are several things we had to go through training on. All the different aspects of administering vaccines, safe storage, the Vaccines for Children program. So we are educated in these things and have to obtain a certification to be able to do what we're doing. Again, our access to vaccines, VaxCare, they cover our private stock for insured individuals for both adults and children. The Vaccine for Children's program is a federally funded program that provides vaccine to children who may not otherwise receive it due to inability to pay. So there is no charge to those children to get the vaccine. In some cases, places will charge an administration fee. However, the child cannot be turned away for vaccination based on not being able to pay that fee. So it really ensures that children who are seeking, parents who are seeking vaccination for their children are able to get that. The Indiana Adult 317 program that provides vaccination to adults who are uninsured, whether it be because their employer doesn't offer it or because they are unemployed or any of those things, we're able to provide vaccine to them as well. So we're really able to fully service all areas. There aren't any areas really where we end up where we're in a pickle. And in that case, individuals are always able to pay for their vaccines out of pocket if they so chose. But we really have it covered to where no one really should have to do that. 2021 initiatives. We've been working with the schools to do school age vaccinations for Crawfordsville South and North. We are currently in the process of setting up all the back to school kindergarten roundup vaccine clinics. So we're working on that presently. This is just a snapshot of what vaccinations are required for school age children. So you can see your pre-K and K, we have those K through 5th grade vaccinations. That pre-K range are usually children that are seen there in the clinic by a physician. That's usually during their well child visit and things like that. So we don't see a lot of that age range, but the K through 5th grade we do. I've been working very closely with Amy Bales at CMS and with Donna Swank up at North to get in and make sure that those 6th graders are taken care of. We've got a couple of clinics coming up for them, and then making sure that the 6th through 11th grade and the 12th grade vaccinations are all taken care of before they leave for either college or they enter the workforce. So school age vaccination, again, we're focusing on kindergarten roundup with all 3 schools. Meningococcal B and ACWY vaccination clinics we're holding for all 3 school districts as well. And then any catch-up vaccinations. Let's say someone enters the school system from out of state or out of this area, or they haven't had vaccinations before in the past, or they're behind on vaccinations. We schedule catch-up clinics so that we can get those kids in and make sure they're taken care of as well. This is just a couple of screenshots of some of the campaign material that we put out. We design all of these ourselves and tailor them to each school. So you can see the one on the left there is a back to school meningococcal and MenB immunization clinic, and the one on the right is a catch-up vaccine clinic for North. Yes, for North. COVID-19 vaccinations, that's kind of the hot topic right now. That needle looks a lot bigger on a PowerPoint than it does in the actual little image. But either way, so COVID-19 vaccinations, we've been working closely with the health department to partner with them. The Homebound Seniors program has gained statewide news. Many of you probably saw it on Fox 89 and on Channel 18. They came out and rode out with me for 2 days. 59 came out for a day, and then 18 came out for a day, and then wrote respective articles on the Homebound program. Since then, I have had tens of people text me that I know in the EMS community asking why we had to go and do this, because now they are going and doing this. So it's spread like wildfire, and it's great. It's providing an essential service to those that can't get out of their home. I can't even tell you the amount of just palpable gratitude from people when I'm able to go out to their home because they can't leave the house, either because they are disabled or they have been unable to get out for weeks or months based on injuries or illness. And it's just been a great thing to provide to the community. So with doing home to home vaccinations, there are less people that get serviced, but it is just such a high impact initiative. It's been really great for those that have taken advantage of it. And if you know anyone that is in need of that service, you can find on our Facebook page, there's a link, they can send a message. There's also a phone number on there and an email. And that's a snippet of the Facebook ad there. And again, we collaborated with the health department initially to use the Johnson & Johnson vaccine. That again is the one-shot vaccine, so it doesn't require them to get back out and get another shot, or for us to come back out to their home to see them again. So it really does provide that one and done service. And again, if you look, I don't know if you can see my cursor or not, but if you look here, the phone number is on there, and then the vaccine website or the email address is on there as well. We held a very large teachers vaccine event that gained, I think, just under national attention. It was all over the state. I do think it did get picked up a few places outside of the state. But we held an event with all of our teachers the day after it became available to teachers. Governor Holcomb announced it on a Saturday. Sunday went by, and Monday we held a clinic. We were right on with getting the teachers taken care of. So we held a small event with a select 30 teachers for press and media and things like that to get started. And then we had a large event that Friday in which we vaccinated 220, both teachers and ancillary staff for the school. So very high impact with them. And again, 220 teachers and staff across all 3 school districts. Ironic part of this picture, that is me, and that is Samantha Cotton, whom I graduated with from Southmont. So the irony of this picture is pretty impressive. Class of 2006, immunizing, getting immunized, and then the Mountie behind us was quite a fun moment. So the jail population here in the county, we've gone out there twice now to immunize against Hep A, Hep B, and the flu. This is a very special population in the sense that they're all enclosed, they're very close. It's obviously a very tight space for them to be in. And when one of these issues starts up, like a flu spread or COVID, things like that, it can spread very quickly in those environments. And hats off to Sheriff Needham and the jail. They've done a fantastic job of keeping that jail clean and the inmates healthy and safe. And they've done a fantastic job through this pandemic. But we've gone out and helped them to get immunizations done for again, Hep A, Hep B, and the flu so far. COVID testing, again, this is where our wheelhouse kind of comes in. On the drop of a dime, we went and set up a COVID testing site in collaboration with the Montgomery County Health Department over at the old Horner building here in town, just behind the CVS. We ran over 2,000 COVID tests through that site over a few months. This was during the height of that second wave, and it really allowed us to detect and monitor community spread. And then during the time in which we were having a lot of children quarantined from school who were needing testing or close contacts, it really provided a great resource for those parents to come through the drive-through testing site and get their kids tested and then be able to go straight home. So it was an essential opportunity for them. We were also one of the only ones offering evening hours for testing as well. And with Crawfordsville and Montgomery County being a very shift-oriented environment or community, it really provided that wider range of availability for testing. So that was very helpful to the community. Workforce development, we're working on providing key access to vaccination and immunization to Crawfordsville's workforce, both by being available for them to come here and get immunized or us to come to them to do vaccination pods. So we are trying to increase that economic value in being able to provide this to Crawfordsville's workforce as well. I've met with several business leaders here in the community. And again, a lot of the focus right now is on getting that COVID vaccination out there. And we're working on putting together plans to be able to go out and service those individuals and those companies in a pod-like fashion. And that'll allow us to really knock out large numbers of people that haven't yet received immunization again, either due to decreased accessibility or a barrier to getting that vaccination, and bring it right to their workplace where they can get taken care of at work. Does anybody have any questions for me?
If you have a question, please unmute yourself. And Spencer, can we go back to unsharing the screen and let everybody out there?
Yeah.
Thanks. It's amazing to see something like this. And when Paul told me about it to begin with, to think that a community like Crawfordsville, in its size and everything, can do something that is national. That, you know, I mean, national organization, national fire departments are looking at this and saying, wow, if they can do it, can we do it? And I'm sure there's a lot of big ones that it makes it very, very difficult, but it is amazing to see what they can do. And Spencer, thank you so much for being able to do that. You know, my question, the homebound seniors and everything, is that basically just the COVID testing or COVID vaccine, or is it?
I left that part out, but I guess I should have mentioned previously, we did actually do some home COVID testing when that was during the height of that second wave for individuals that couldn't get out of the house. I remember gowning up several times outside of my SUV to go up and do at the door COVID tests for people because they couldn't get out of their home. And in that scenario, if you're sick and you're symptomatic, we didn't want you coming out of the home if you weren't able to safely do that. If you had to have someone who was well or obviously not sick come and get you, that then puts the other person who's coming to get you at risk. So we did do some of that. The homebound vaccinations, though, currently are just doing the vaccinations. So we have a Microsoft form. We just share that with all of the doctor's offices to be able to help get people signed up. We've done about 40 in-home vaccinations so far, and that sounds like a small number, but the community impact with that is very, very high. It does 5 to 6 to 10 in a day is a lot when you're going from place to place to place in the community. And we also sit with these individuals for 10 to 15 minutes post-immunization, just to make sure they don't have an adverse reaction or anything like that. I found myself watching Wheel of Fortune several times last week for 15 minutes at a time. So one lady was really into Cops. She was very, very into that show. We sat and watched it for a few minutes. I think I stayed a few minutes extra on that one, actually. We finished the episode and went to the next house. But yeah, we've been doing the in-home vaccinations, and that again is with the Johnson & Johnson vaccine. So we're only coming out once to do that.
And the ones you do for the school teachers and that, is that all Johnson & Johnson?
No, they received Moderna. So we had additional stock of Moderna to use for that. So they received that.
Okay, so they'll have to do the second test.
They're coming on Friday to do their second dose. Yep.
Okay.
Moderna, they get it 28 days later, and Pfizer, you do 21 days, and Johnson & Johnson, you just don't do again. You get the one and you're done.
Spencer, this is Jerry Dreyer. Regarding the kids vaccination program in the schools, how much, if any, anti-vax sentiment do you run into from parents regarding their kids in the schools?
We have a very offer but not demand perspective. So as you're aware, the schools do require these vaccinations unless you get an exemption from a physician. So the school would have the ability to either suspend or withhold a child if they absolutely felt it was necessary, if they didn't receive it. And so we try and make sure we offer that access. A lot of these children who are unvaccinated, it simply has to do with the parents' access to vaccine. And so I'll get to the anti-vaccination point. But so we have not had a lot of anti-vax feedback. We have a couple of, the feedback we have received has been any questions regarding doing the vaccinations in the school. And that I've really just met with the fact that we're doing vaccinations that are required by the state of Indiana. So it's not like we're coming in and offering, additional things that aren't required. We do we do offer some things, but we don't press those on anyone. We have a very provide that service mentality. We're there to help augment the parents' ability to get that vaccine to their children. But we have not had a lot of anti-vax issues come up. And part of that, again, is when we do market on Facebook, I am very stringent about how I market things. Facebook, Twitter, and Instagram have all taken a very heavy position on they filter comments out based on keywords that are in the post itself. So that does help. I have talked to individuals though that have really been beaten up by anti-vax campaigns, and it's a risk you take when providing this service, but it's an essential service to provide to these kids. And we do have the full support of the mayor, the fire chief, and the community and the health department to be able to provide this service.
Spencer, when you were talking about the vaccines, and I tried to scan the information that you had on your PowerPoint, was the HPV vaccine included? And if so, did you have any issue with anti-vax on that?
No, so it is offered, and we've administered a handful of those doses this year, just in the last few months. It's not a required vaccine. So when we hold the meningococcal B clinics, we typically also offer Gardasil, which is the HPV-9 vaccine. So one of the big things with that vaccine in particular, and I'm sure you guys remember when it was very all over the news back in 2016, the original formulation that came out with that is not the same formulation that's used today. They've made some changes to it, and I've done my research on it, and it is something that I would feel safe my children getting. And so when I advise parents, I advise them to seek counsel with their primary care physician or pediatrician, and then to make that choice with them and their child. And we've had a handful of parents reach out and say, hey, we'd like to have our child get this while they're there getting their other vaccinations. So it does provide that ease of access to the parents.
Thanks.
Very, very interesting. Okay, if we know someone that needs a vaccine, or thinks we could use it, do we send them to you, or do they wait for a clinic if it's a child or whatever? Do they wait for a clinic or what?
So I would recommend just following that link that was on the Facebook page, and they can get. I currently manage our Facebook and Instagram, so if they message us on any of those platforms, it comes back to me anyways. So if they are in need of something like that, they can reach out there. And I think my contact information is listed as well under those. And I know that all the school staff, the school nurses have my contact information, as well as the health department.
What does the future hold for this thing? I mean, your home medicine type thing is amazing, and okay, so COVID-19 is gone in a year, maybe, hopefully. What do you see down the road? Do you see this growing even more?
So I think one of the things that they have found is that there is a very large aspect of vaccination and immunization that can be very well suited to the mobile integrated healthcare model. And that's what my job has been since I started, was to identify how we can best roll this part of medicine into community paramedicine. So one of the things you're going to see come this fall is a push for the flu shot like you've never seen before. And with, I should say, access to the flu shot like you've never seen before. We're going to do mobile clinics. We're going to set up at various industries. We're going to set up drive-through flu clinics to where you can come through and get a drive-through flu vaccine. And we're going to really work on increasing the accessibility to that. And again, we do not know yet what the guidelines and expectations are going to be here in the next 6 months for the COVID vaccine. So that's something I won't specifically speak to, but it is something that I can say will be a topic of conversation over the next 6 months as to whether that will become a routine vaccination, or if this was more like the H1N1 at the time to get through the pandemic that we're in. So that will be interesting to follow over the next 6 months. And again, since these vaccines were developed at the pace they were, we're just now starting to be able to test those that were in the initial phase 3 trials to look at how viable, what the viral load for those patients are from the vaccine itself, what their antibodies are at a year out. Those individuals who were in last year's phase 3 trials are just now entering that 1 year mark. This is why vaccines typically take 3 to 5 years to be developed, because they study and study and study. But with this being the emergency situation that it was, they were able to develop that very quickly. They proved efficacy in those 40,000 clinical patients, and then were able to get approval to start using it under that emergency use. So that's been an amazing effort that really shows just how far we've come in terms of medicine over the last 30 years.
Great. I heard you and Paul presented or are presenting at some national forum for this.
Yeah, this is all practice for me to have to speak to like 5,000 people come October. So
okay,
yeah.
Good.
So yeah, we're going to be at EMS World, and from what I understand, the portion that I currently oversee is going to be featured as a speaker to talk there. So I'll have to put a couple more slides in that PowerPoint to fill up. I'll be done in 5 minutes if I just go up there and rattle that whole PowerPoint off. So I'll have to add some stuff to it.
Well, it's fantastic that, you know, Crawfordsville and your department is being recognized nationwide for something like this.
Yeah.
Anybody else have any questions?
Yeah. Spencer, are there enough paramedic people in the world to do this everywhere?
So my answer to that would be, in areas where the healthcare system is not as robust, this is an excellent way to use that avenue. In areas where individuals, small towns might be set up, 20, 30 miles, 50, 60 miles apart. This is an excellent avenue where we can develop and build the blueprint for going out and doing this. And then that division is given the vaccine, given the handbook for doing it, and they're able to go and vaccinate those communities that are in outlying areas. You look in places like Montana, and there can be a 2-hour drive to the next major city. So if you send one person out to that small town to vaccinate that entire community, that can be an essential service. In areas like Indianapolis, you can't really throw a stick without hitting a fire station or a hospital. So those individuals typically have more access to medicine and to healthcare in general. So those areas, yes, it is still important, but those individuals do typically have better access. So this does suit well to a rural healthcare setting, where we're able to go out into those small communities and hold these events to provide better accessibility.
What do the homebound?
I guess to answer your question, it wouldn't be something that you would deploy everywhere, but in areas where it is applicable, like rural areas or somewhat urban areas, this is an essential service.
What do the homebound people in Indianapolis do? I mean, is there some type of service that comes and give them this?
So they kind of did a little bit of the same thing. It was somewhat different. With Indianapolis, they were able to leverage other resources in terms of community clinics and things like that. So although there is a large population of homebound individuals in that area, predominantly those individuals find themselves in assisted living facilities or shared communal housing, large communal apartment buildings, things like that. And so they would send one person out to that area and they would take care of that entire complex. And that was where CVS and Walgreens came in to do assisted living facilities, nursing homes, and things like that. But they did trial a homebound-like program, but it was facilitated on leftover vaccine. So they would establish a list of individuals who were in need of this service. And let's say A clinic at 38th and Keystone had 30 people not show up for their vaccine that day, which their no-show rate is a little higher in those areas. So it was a need. They would then take that 30 vaccine and go door to door to give that. But the seeking individuals out to do that was something that we did that made us different than anybody else that was doing it. We've provided this service on a little bit of a different, more of a tailored level than some of these other communities have. But I have been following, again, I have hundreds of friends in the EMS community over the last 15 years. And I get texts every couple of days from people that are like, hey, guess what we're doing now? Yeah. We're doing homebound vaccinations, because they see how awesome of an impact that has with those individuals. And they're going out and doing it. The last one I just saw was Columbus Regional is sending an ambulance out every day to go and do homebound vaccinations. They didn't have any of that infrastructure before. That wouldn't have been on their radar before. But we went and did this, and it made the news. And now other communities are seeing how awesome that can be. Teachers were the same thing. But 2 days after we held our clinic, Lafayette sent a big thing out of providing vaccinations to teachers. And trying to hold some clinics and things like that. So,
well, thanks for being a leader in all of this.
We're trying to be. I'm under the direction of Paul. He kind of gives me a lot of rope and tells me to go, gives me a broad target, and my job is to go out and make sure we hit it with the amount of rope that I get. So
great. Well, thank you so much. Any other questions? Okay, Spencer, thank you so much, and we really appreciate the information and helping the kids in the community. I guess that was one other question I had. You said with Crawfordsville, are you doing the whole county?
Yeah, so we're covering North Montgomery, South Montgomery, and Crawfordsville. Just due to the sheer population in Crawfordsville and the number of schools, the number of children who do need this service are greater in the Crawfordsville area. That's just how that works out per capita. So we've seen a great response from parents so far in terms of holding. I have 5 clinics set up for next week between the Crawfordsville schools to be able to make sure those kids are taken care of. Removing the barrier of having to take their kid to the doctor's office in the middle of the day for a 5th grader who doesn't really need a child visit. They're not sick, they're not ill, they're in between that age of needing a checkup, but they just need shots. And so we're able to provide that service in the school, hold a clinic, have them sign a permission slip beforehand or a consent, informed consent, and then take care of that while they're at school for the day. Mom or dad doesn't take off work, they don't have to schedule it during the evening, they have to go to try and find a doctor's appointment. We're able to just provide that essential service. So removing those barriers and increasing accessibility. I know I sound like a broken record with that, but that really is the goal of this program, is just increase accessibility and remove barriers.
Sure. Well, again, thank you very much, and thanks for your time today. We appreciate you being here. Thank you.
Thank you for having me.
So, okay, for everybody, our next meeting in Spencer, anytime you want to join one of our meetings, come on out. We'd love to have you. I think everything we do is for the kids, and what you're doing is for the kids. So we really appreciate it.
Well, I'll keep you guys in mind. If we hold an event or we need some volunteers or we want to get some stuff out in the community, I'll definitely reach back out to you guys.
Great. Thank you. Thank you.
Have a great day, guys.
Thank you. You too, Spencer. Our next meeting will be April 15th, and our speaker will be Brad Montz with Hoosier Heartland. And Karen's got that all set up. She made sure that he's gonna speak to us, so everything will be right there.
He just doesn't know his topic yet.
You still don't know his topic yet?
No.
Okay. Well, he'll figure it out.
It'll just be a surprise.
That's
anything about money, I guess he knows.
Yeah.
He knows a few things about that, I think.
Well, he could bring some samples.
Yeah, that's right. He can distribute some samples to us, or Bud's not on here because Bud would want Bitcoin. Positive thought of the day. A positive attitude may not solve all of your problems, but it sure annoys enough people to make it worthwhile. So keep that positive attitude. Thank you so much. And hey, we're going strong, and we appreciate it. So we'll see you next week. Thank you.
Bye, everybody.
Bye now.
Bye.